Afternoon, my name is Hyson and I'm here to perform head and neck examination. Hi, good afternoon, sir. How are you doing? Hi,
Good.
what's your name?
My name is Paulo.
And what brought you to the clinic today?
I will have my head and neck examination.
Okay, so first we're gonna examine the head, checking for symmetry, contour, shape of the head, any obvious deformity. We're gonna check the hair for distribution. We're gonna palpate for any scalp tenderness, lesions, any breakdown. So no noted scalp tenderness. The hair is evenly distributed. Um, the texture is coarse for the patient's hair. No signs of any integumentary rashes or any cysts. No lesions. No mass noted. Patient's head is normocephalic and atraumatic. So then we're gonna move over to the eye examination. So we're gonna start using the Snellen chart. We're gonna check the patient's visual acuity. So I'm gonna ask the patient to stand up and stand behind the Snellen chart 20 feet away. So for the purpose of this exam, we're gonna have the patient still visible, but in reality, we have to ask the patient to stand 20 feet away to accurately measure the vision. So we're gonna ask the patient to first read all the letters until he can't read it anymore, both eyes, and then next we're gonna ask to close one eye at a time. So, sir, can you please read all the letters and tell me when you cannot read it anymore? Okay?
Okay. E F P T O Z L P E G P E C F G E D F C Z P F E L O P Z D D F P O P E C.
Okay. So, patient was able to read 20 feet and 20 vision. So, we're gonna ask one patient to cover one eye with the card.
E F P T O Z L P E G P E C F G E D F C Z P F E L O P Z D D E F P O P E C.
And then cover the other eye, please.
E F P T O Z L P E G P E C F G E D F Z Z P F E L O P Z D D E F P O T E C.
Okay, so the patient was able to read 20 over 20. So it means that the patient can read 20 feet, which is a normal patient can read in 20 feet. So the higher the denominator, the poorer the vision. So patient is able to read 20 over 20 with no corrective lens or no glasses. And next we're gonna move to the inspection of the eye structures. So we're just gonna check the brows for hair distribution. So there's no spots of dullness on the eyebrows. No scaling, no crusting noted. The eyelashes are turned outward. Upper eyelids cover part of the iris, which is normal finding. And then next we're gonna palpate the lacrimal system. So we're gonna uh, check palpate the lacrimal sac just to check for any excessive tearing or dryness. So no excessive tearing or dryness noted. Then we're gonna check the conjunctiva. The bulbar conjunctiva is clear. The palpebral conjunctiva is pink and it's clear. The sclera is white, no lesions noted. And then the lower eyelid has no lid lag, no edema or swelling. It has adequate closure. There's no lesions or any deviation on the upper and lower eyelid. And then we're gonna use a light source to check for the cornea and the iris. Okay, so we're just gonna shine a light on the eyes. So the cornea light reflex is normal, the lens is clear, and then we're gonna move over to checking the pupillary response to direct, consensual, and accommodation. So we're gonna ask the patient to just look straight ahead, and then I'm gonna have to shine a light across your eye. It's just to check if your pupils are constricting in both eyes. Okay?
Okay.
All right. So can you just please look straight ahead? Okay, so I checked for the direct pupillary response. The patient's pupils contract from 4 millimeters to 2 millimeters, and I'm gonna check for the consensual reaction. So the opposite eye constrict the same 4 millimeters to 2 millimeters, and then we're gonna check for accommodation. I'm gonna ask you to look in this pen and then the wall behind you. Okay, look at this pen, look at the wall behind you, look at this pen, look at the wall behind you. So the patient's pupils constrict as well when it's looking at the near object. So the pupils are equal, round, reactive to light, and accommodation. And now we're gonna check the extraocular motor of the eyes. So we're gonna check for the 6 cardinal gaze. We're gonna ask the patient to follow the pen light just with his eyes, not the head. So sir, I'm gonna ask you to follow this pen light when I move it to different directions, just to check for your extraocular movement. Okay? So patient's extraocular movements are intact. The oculomotor, trochlear, and abducens cranial nerves are all intact. And then we're gonna check for convergence. So I'm gonna ask you to just follow with your eyes only the pen light. So patient was able to follow the pen light with his eyes, and then we're gonna check for the accommodation. So again, sir, I'm gonna ask you to look at the pen light and then the wall behind you. Pen light, wall behind you. Pen light, wall behind you. So he was able to do that as well. And then next we're gonna check for the visual fields using the confrontation. So sir, I'm gonna have to. You just have to look at me, and you're gonna have to let me know when you can see the my fingers. Okay?
Yeah, I see. Yeah. Yep.
So visual fields are all intact. Now we're gonna do the ophthalmoscope. So we're gonna ask to dim the light. So we're gonna just have to maneuver the ophthalmoscope and make sure it's in the correct settings. And then you're gonna hold the ophthalmoscope 15 degrees. Use the left hand for the left eye and the right hand for the right eye. So I'm gonna do your right eye first, okay?
Mm-hmm.
So I'm just gonna follow this this light towards your eye and just look straight ahead, okay? Okay, just checking for any abnormalities. Okay, optic disc is intact. This is flat with sharp margins. The retinal background has no hemorrhage or any exudate. And we're gonna do the other eye too. Okay, so just look straight ahead, sir. It's the same. The cornea and the lens doesn't have no opacities. Bilateral red reflex is present, and there's no AV nicking or no hemorrhage noted on the optic disc. And then now we're gonna check for the patient's nose. So we're just gonna inspect the nose for any symmetry, any obvious deformity, no deformity noted. And then now we're just gonna check for the patient's sinuses, palpate the frontal sinuses. Is there any pressure, any pain?
No.
So no pressure, no tenderness, no pain noted. And then we're gonna check the inside of the nose. Using a light source. So I'm gonna ask you to extend your and then we're just gonna have to go look. Okay. So the mucosa is moist. The turbinates are pink. There's no swelling, no lesions noted, no deformity. The septum is midline. Nares are both present and patent. And then now we're gonna check for the airflow of both nares. So I'm gonna ask you to go a little bit. So both nares are patent, and then we're just gonna ask for patient to differentiate two odors to check for the olfactory cranial nerve. So I'm gonna ask you to close your eyes and tell me what you can smell. Okay? Can you smell this?
Yeah. So coffee.
Okay, thank you. So the patient able to identify the coffee correctly, and then I'm gonna ask you to smell another one. Close your eyes.
Garlic.
So is patients able to differentiate both odors and correctly identify the garlic and the coffee. And then next we're gonna check for the ears. So we're gonna ask the patient first. We're gonna perform the test. First is the whisper test. So I'm gonna ask the patient to move the other side. Can you, yeah. And then I'm gonna do the whisper test. So make sure the patient can read your lips. Okay. So just look that way, sir. And then I'm gonna ask you to repeat what I'm gonna say. Okay.
Okay.
So just kind of cover his eyes so he won't see what you're saying. And cover and occlude the one ear, and kind of do a circular motion to the tragus to make sure that the patient won't be able to hear you. Okay, I'm gonna whisper a word and you have to let me know what is it. Okay?
Okay.
6
Yeah.
1. Can you repeat that?
6-1B.
Okay. And can you do the other because I have to do the other eye, the other ear.
6-1A.
Okay, so the patient was able to say both of the whispered words that I said correctly. It's a combination of letters and numbers. And then next we're gonna do the Weber test to check for lateralization, hearing loss. So I'm gonna put this on top of your head, and you have to let me know if you could hear it in both ears. Okay?
Okay.
Can you hear it in both ears?
Yep.
Okay.
Yep. I can hear it.
So Weber test is midline. It's here on both sides, and then we're gonna do the Rhines test, in which I'm gonna have to test if the air conduction is greater than bone conduction. So I'm gonna put this tuning fork behind your bone here, behind your ear, and you're gonna have to let me know when you can hear it and when it stops. And then I'm gonna put this also in front of your ear, and you're gonna have to tell me when you hear it and when it stops. Okay?
Yep. Okay.
Can you hear it?
Yep.
You have to tell me when it stops.
Okay. Stop.
Can you hear it?
Yep.
Tell me when it stops.
Stop.
Okay, so we do have a normal finding because the air conduction should be greater than the bone conduction. So the patient can hear it longer here than just on the bone. So we have normal finding for the Rhines test. And now we're just gonna check the patient's ear, check the external ear for any discharge, any lesions. We can do the tongue test too to check for any pain when the patient's tragus is touched in the auricles. Do you have any pain there? No? So no discharge, no lesions noted, no calcification, no tophi. We're gonna check the tragus, no pain and no tenderness. Identify the landmarks, the antihelix, the helix, the lobule, orifice of the external meatus, the conchae. So the patient has a normal external ear, no discharge noted or any lesions. And then we're gonna check the otoscope. Okay, so for adults, you're gonna have to pull the ear and backwards, pull upward and backward. For children, you're gonna have to do downward and backward. Okay. So, sir, I'm just gonna check your ear. Okay,
So
using the otoscope. So you're just gonna anchor your hand up and then backward, and you're gonna insert the otoscope. Gonna do a downward motion. Look for the external ear. It's clear. No discharge. No lesions noted. The tympanic membrane is pearly gray. No cerumen noted. Tympanic membrane is gray, pearly gray, with good cone of light. The landmarks are identified. The umbo, short process of malleolus, and the handle of malleolus are all identified. The tympanic membrane has no perforations, no bulging. It's pearly gray, so it's all normal findings for the ears. Okay. And then we're gonna move over to the examination of the lips. So we're gonna just first inspect the lips, the outer lips, for any obvious lesions, any breakdown, dryness. And then we're gonna palpate the lips to palpate for any mass or any abnormalities. So we're gonna inspect the lips. The lips are pink and no masses or nodules noted. Then we're gonna ask the patient to open the mouth so we can check the buccal mucosa. Can you please open your mouth? And we're gonna use a light source. Okay. So buccal mucosa is moist. It's pink. No swelling or no breakdown. And then we're just gonna check for the gingiva. The gingiva's pink, no bleeding, no breakdown, and then we're gonna check for the patient's gums, and then the teeth, no dental caries, no loose teeth, no missing teeth, no dentures. Then the next we're gonna check for the patient's tongue. The tongue is smooth. Can you move your tongue up? Okay. The salivary ducts are there. The Stenson ducts are opening at the second upper molar bilaterally. And then next we're gonna check for the patient's soft palate. Soft palate are pink. There's no lesions. There's no deviations. And then we're checking for the uvula. Say ah, ah, say ah, ah. Uvula is midline and it's normal. There's no swelling or no bulging. And then the posterior pharynx, say ah. And then the tonsils, posterior pharynx and tonsils are not swollen. No lesions, no any drainage noted on the tonsils. And then we're gonna ask the patient to we're gonna check for the facial nerve. We're gonna ask the patient to smile, frown, puff cheeks. Okay. And then next, we're gonna move over to the neck examination. So first we're gonna check for the movement of the neck. We're gonna ask the patient to flex, hyperextend, do lateral rotation, and then we're gonna check for the spinal accessory muscle. We're gonna ask the patient to resist our hand when we try to push the shoulder shrug, so the patient's able to resist. And then we're gonna ask the patient to resist our hand when we try to turn the head, so it's like the turning against resistance. So patient's able to do that. And then next we're gonna check for the check and palpate for the lymph nodes. So we're gonna check for the preauricular. So you use the pads of your hand to palpate. Patient doesn't have any palpable lymph nodes in the preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. So the patient doesn't have any palpable lymph nodes on all the areas that we just palpated. And then next, we're gonna check for the trachea. So we're gonna inspect, and we're gonna put our one finger behind the trachea and the sternocleidomastoid muscle. So it's there. And then the other side too. So the trachea is midline, no deviation. And then next, we're gonna check the patient's thyroid. So we're gonna use a light source and do a tangential view of the thyroid from the side. So I'm just gonna ask the patient to hyperextend a little, just a little bit. So we're gonna check for the any thyroid bulging or any obvious deformity. So we're gonna ask the patient to swallow, and while we're inspecting, can you help us a little bit? Okay, okay. And then also palpate and ask the patient to swallow. So we're gonna look for the landmarks. So this is the thyroid bone, the cricoid bone. The thyroid isthmus should be laying on the second, third, and fourth, overlaying the tracheal ring. So the isthmus usually should not be palpable, but it's some of the patients it is palpable. And then we're gonna palpate for any swelling, any nodules, or any masses on the thyroid. So you can ask the patient to hyperextend a little bit and drink a little bit of water. Okay, so it moves up and down. It slides without any pain or any problem. Yeah, the patient's thyroid was able to move up and down freely and smoothly. So there's no obvious tenderness or any nodules or mass noted on the thyroid. Okay, so that concludes the head and neck examination, and thank you so much for watching. Have a good day.